as individually, meron po tayong magagawa para po makatulong sa ating health ng ating public. So, what can you do to help? Ano pong pwede po nating magawa individually? Ano ba pong mga pwede po nating gawin? So, first and foremost, tignan po natin yung disease prevention. Kailangan po nating ipagpatuloy yung ating mga ginagawa. For example, social distancing, yung pong ginagawa po natin na paghuhugas po ng kamay, napaka-importante po nito. Mas lalo po ngayon na wala pa po tayong talagang vaccine. So, isa po sa mga yung paghuhugas ng kamay. So, importante po yun. Then, paglilinis ng ating mga environment, kung ano po yung mga madalas po nating hinahawakan. Siyempre po, importante po yung cough etiquette. Huwag po tayong uubo. Kailangan po natin tapan ng ating mga bunga kapag umuubo or nag-sneeze or wearing a mask. And ito pong isa, yung noting where we go and who we interact with. So, isa pong importante na part ng is contact tracing. Yung kailangan po natin, kung halimbawa, nagkaroon po ako ng infection, kailangan po natin i-trace sino ba yung mga nakasalamuha ko. And madalas, ang mahirap po dito is kapag hindi po talaga natin inaalala, pwedeng makalimutan po natin, ay yung nga pala na minute ko pala si Lola or nung nakaraang araw, etc. So, kailangan po natin galingan na talagang tandaan saan ba po tayo nagpunta, sino yung sinakyan natin, sino yung mga nakaka-interact po natin para eventually kapag may magkaroon tayo ng infection, madali po nating matratrace sino pa ba po yung mga posible na merong nahawaan. Next po is yung kailangan nating panatilihin na ang ating healthy. So ano po yung na healthy po ang ating katawan natin. So what does it mean? So first and foremost, proper nutrition, exercise, especially now in the lockdown, we tend to be more dito. Sometimes we don't move a lot compared to when we are working outside. So we don't commute, etc. So there should be an effort in ourselves to really continue exercising. And next is adequate sleep. Nag-uusap nga po tayo, nag-usap nga kami ng isang araw ng mga kaibigan ko na ngayong quarantine, nag-shift na yung tulog. Parang puro na lang internet, inaabot na ng madaling araw. Pero kailangan pa rin po natin, especially with this pandemic going on, we should really have adequate sleep because ito po talaga yung isa sa mga pwedeng magpababa ng immune system po natin, yung mga tulog. And next is stress management. Ito yung mga usually na hindi masyadong nabibigyan ng pansin, especially yung mental health po natin. So, ito pong COVID-19, nagbibigay po siya ng undue stress. Dahil kasi yung mga, for example, problema po natin, ano yung kakainin natin, gusto na natin lumabas. So, kailangan po natin maghanap ng paraan. Paano po natin mapapababa yung stress para po mas hindi po tayo maging anxious sa mga iniisip po natin. Pwede po natin i-try breathing, exercise, po siya. And also, kumustahan ba na hindi porket na isolated tayo, na mag-isa lang po tayo. We could talk to our friends, marami na rin yung mga technologies natin. We could Viber or text or call our friends para makumustahan lang and to vent out our frustrations para hindi po natin kimkimin lang. Next is yung pong health-seeking behavior po natin. So, kailangan po nating maging mapanuri yung sa ating mga nararamdaman. Unang-una po, patunayan na mas malaki ang risk yung mga merong non-communicable diseases katulad ng hypertension and diabetes. Pero ito pong mga sakit po na ito, hindi naman po kaagad, hindi po siya yung katulad ng ibang sakit na readily mo makikita. Kung minsan po, for example, hypertension, you could have very high blood pressure without feeling anything. And kaya paano lang po malalaman po natin is kapag po magpa-BP. So, kailangan po natin yung, kahit na wala pong nararamdaman, kailangan rin po nating magpaskirin, blood pressure, regular blood pressure monitoring, especially kapag tumatanda na po tayo. And also, kailangan rin po nating tignan yung asukal po natin sa dugo. Ang mga sakit kasi na ito, kapag maagapan, mas mapapaba po natin yung risk regarding sa komplikasyon. Next po is yung prompt medical consult. Minsan po, ang problema sa mga Pilipino, masyado tayong matiisin. Kahit meron tayong nararamdaman, wag na, kaya na to. So, kapag meron po tayong nararamdaman, we need to consult. Kailangan po natin talaga mangguni sa doktor para malaman po and mabigyan po tayo ng kakulang guidance. Also, honesty in disclosing past and current medical histories. Meron po mga kumakalat na stories na yung mga ibang mga health workers na ka-infect is because na hindi po sinabi ng patient yung talagang history niya, yung travel history, na meron pala siyang nararamdaman na inuubo pala. So ito po, yung pong takot po natin, baka meron po tayong takot na magsabi na kung anong nararamdaman po natin. Pero isipin po natin na hindi lang po tayo ang maapektuhan kapag hindi po tayo nagsasabi ng totoo. And also, kapag kailangan rin tayo as a person, kailangan rin natin na wag rin i-judge, especially yung mga mayroong sakit. Hindi naman po, yun nga po, lahat po tayo may risk na magkaroon nitong virus po na ito. So, wag po nating i-discriminate po sila. Kasi kapag nagdi-discriminate po tayo, mas tumataas yung chance ng ibang tao na hindi magsabi. So, kailangan po in this day and age, kailangan po tayo maging more transparent sa kung anong nararamdaman natin and more caring to each other. And yung last po is yung active participation sa disease management. Kapag sinabi po na kailangan po natin na manatili muna sa bahay for 14 days, kailangan po natin na mag-participate po. And also, kailangan rin po natin na hindi rin po maging passive. Kailangan rin po natin magtanong sa ating doktor, bakit po ito yung treatment na ina-advise, how could you help? Next is health education. So we really need to understand tayo mismo na we should learn to look out ano ba yung disease processes, paano ba natin ma-prevent. Yung isa rin po dito is we should really know saan ba po yung mga hospital. Kapag magkasakit po tayo, sino yung pwedeng tawagan. Ano ba po yung mga healthcare services, health programs na nasa sa ating munisipyo. Yung regarding po doon sa PhilHealth po natin, paano ba po natin magagamit po yun. Tapos, when, kailan, saan, yung gagawin yung medical po. So, importante po kasi po talaga po to kasi parang dapat po hindi po tayo maging passive na hihintayin na lang po natin yung health services na ibigay po sa atin. Kailangan rin po nating malaman ano ba po yung mga serbisyo na pwede po nating makuha. Next is critical mindedness. On the flip side po nung pag-search ng information, especially regarding COVID, kailangan rin po nating maging mapanuri kung doon sa mga information that we are receiving. Saan ba po nanggaling po itong information na to? Madalas, may mga, especially in the social media, there are many information that's up. A friend, may mga kaibigan natin, maaaring mag-send ng mga infographic messages. Unang kailangan po nating matanong, matatrace pa natin saan nanggaling po itong information na to. And kung matatrace natin, kailangan natin malaman, totoo ba to? Or etong site ba po na ito is known na naglalabas ng maling impormasyon. And kailangan rin po nating tingnan, maging worry po tayo kapag yung mga nare-receive po natin, for example, itong gamot na ito ay mag-cure ng lahat ng symptoms ng COVID-19, etc. Maging mapanuri po tayo, especially kapag yung talagang toka ng emotion, yung talagang nag-attach ng emotion po natin. So kapag may nabasa po tayo na, for example, nakaka-high blood, mag-cool off po muna tayo, tingnan po natin, maging mapanuri, totoo ba po to? Or sinong baka merong ibang mga person na niloloko lang ako. And also, lastly, awareness on other health issues. Tandaan po natin na yung COVID-19, ito po siya yung pinaka-pressing, pero we should not forget that there are other health issues na we need to tackle. For example, wag nating kalimutan na kailangan rin po ng mga anak po natin na kompleto yung bakuna. So, yung pong mas lalo ngayon, napadating na naman po yung tag-ulan na possible na mag-increase na naman ang mga rates ng mga other diseases, for example, dengue. So, we should be prepared with that. Search and destroy. Huwag rin po natin kakalimutan and also be prepared for the typhoons, earthquakes, other diseases po natin, and also our own pay attention with our own mental health. Lastly, I want to end with a short clip to emphasize that even with just little acts of kindness, acts of yung mabuting gawain, we could really help each other.
Having trouble going to the supermarkets. So I decided I would do the simple thing, giving free toilet paper in one refrigerator bag. Sadly, some persons were stolen from the delivery, and the patient community. So I thought it would be a good idea to collect and deliver all the parcels. So we donated 10 kilos of chocolates to the hospital staff. Especially something just as a superhero. And why is Natasha a superhero? Because he's working hard and helping everyone during COVID-19. He works at a chemist and a supermarket. So we prepared 100 meals this week. And 130 each week while we can keep accessing groceries. Last Thursday when I went to the letterbox, I found a piece of paper inside with a note on the front saying, "Had some luck, paying it forward." This totally blew me away and made me cry because financially I've been struggling so bad.
We put together 120 boxes of essentials for the household. We distributed these throughout New South Wales and Sydney.
We all come together essentially just to help one another. All of those people in the community who are our neighbours.
Particular note went down to all our neighbours on our street, just offering them to connect with us as we're all stuck inside. Several WhatsApp group. We've now got about 20 of our neighbours, many of whom we've never met before.
I think everyone should help one another. Stranger to do this restored my faith in humanity. Kindness to me is giving a person a hand in life. Every single time we do something good for others, it takes a focus off ourselves. It takes away that doom and gloom that's engulfing everybody at the moment. The message is clear. It's that we're here and we're standing together.
So, yun po. Thank you po for listening, and that ends my presentation.
All right. Thanks, Doc GR. Ayan. Thank you po, Doc GR. It's just another reaffirmation that all of us, each one of us has a role to play in this pandemic. Our personal actions have effects in greater scheme of things, and we have the responsibility definitely to adapt to health-seeking behavior, being fully informed and aware of the different health issues surrounding our world today. Ang dami na nating questions at this point, but in the interest of time, siguro tuhugin na natin. Let's continue with our next presenter para mamaya dire-diretso ng ating discussion. Doc Aileen, hello?
Yes.
Ayan,
Hello.
Yes, thanks, Doc Aileen.
Hi, Alvin.
Yes, our next speaker is a family medicine specialist who worked on various projects related to disaster recovery and response. She previously served as Chief Medical Professional Staff of Eastern Visayas Regional Center. She graduated medicine from Cebu Institute of Medicine and Masters in Public Health from UP Open University. Let's all welcome Dr. Aileen Espina. Hi, Doc Aileen.
Hi, Alvin.
Thank you for joining us this afternoon.
Yeah. Okay, so maayong hapon. Magandang hapon po. Next slide, please. I am Aileen Espina, and I am a family physician by training and a public health practitioner for most of my professional career. I am a Yolanda survivor, and I was the chief architect of Eastern Visayas Regional Medical Center, the last hospital staff. That lens and my experiences from that strongest typhoon in history in the sharing of my thoughts this afternoon on how government is responding to COVID and how we can design new normal amidst this COVID-19 pandemic. So next slide, please. My presentation, next slide, would have three parts. The previous slide. Okay. The first would be my sharing on my thoughts on COVID-19 vis-a-vis the Philippine healthcare system and how healthcare delivery would change in the new normal and the challenges that we will be facing in the new normal. Okay, so next slide. The first confirmed case of COVID-19 in the country was diagnosed sometime in January, and it was a Chinese national who visited the Philippines. So it was an imported case, and it was a tourist, and we even had the first death outside of China then. Curiously, we did contact tracing, but there was no confirmed local transmission at the time. So we had the proverbial calm before the storm in the whole month of February, since we didn't have any documented case for the entire month. The first local case was confirmed in March 5, and there has been no turning back since then. Now we have more than 10,000 cases, a high case fatality rate, with more hotspots being identified outside of NCR, such as Cebu City, the province of Rizal, the province of Laguna, and other areas in the country. We have been urged to stay home as the country was placed on community quarantine in March in an attempt to flatten the curve. Napaka-familiar na po sa atin yung term na yan, flatten the curve. Ano po ba yung ibig sabihin ng to flatten the curve? It was actually an attempt to slow down the increase in the number of cases of COVID. Dahil kung magkasabay-sabay po ang pagkakasakit ng mga tao, lalo na po kung ang magkakasakit are those belonging to the vulnerable population, and this would include the elderly, people who are 65 years old and above, people with unstable comorbid conditions, yung mga uncontrolled po na hypertension, uncontrolled na diabetes, mga immunocompromised, like kung meron po silang cancer, patients who are morbidly obese. These patients have been documented to have a very poor patient outcome. Yun po yung ayaw natin, na magsabay-sabay pong magkakasakit ang mga tao kasi hindi po talaga siya kakayanin ng ating healthcare system. We do not have enough hospital beds, we do not have enough ICU beds, and we do not have enough mechanical ventilators. Alam naman po natin yun, matagal na, that our healthcare system is far from perfect. In fact po, and I would like to request for the next slide. Next slide, please. COVID actually just opened a Pandora's box, and hopefully, it will be a wake-up call. Kasi po, nung nagkaroon po ng COVID, nagising po yung mga tao. It became, napag-usapan siya, and a lot of things were brought into the surface. I would like to acknowledge the question of Mr. Byron Bokar in the Q&A on bakit daw maraming namamatay, what should be our health agenda now to ensure that all of these bad experiences wouldn't happen again. So, yung nangyari po sa COVID, yung mga problema po that has been besetting our healthcare system through all these years, the issues like the need for more healthcare workers, hindi lang po doktor ang kulang. Kulang din po tayo ng mga medical technologists, kulang din tayo ng mga nurses. Kahit na tayo po ang number 1 supplier ng nurses sa ibang bansa, dito po sa ating bansa, kulang din po yung nagtatrabahong nurse sa mga ospital at sa mga primary health, mga RHU po natin. And also, nakita din po natin na may problema tayo sa ating supply chain management, sa ating pong PPE na napagtuunan po yun ng pansin, na meron po talagang mga PPE shortages that has been reported. And also, yung mga datos po, nakikita po natin na our health information system would certainly can use a lot of improvement. Kasi po, medyo nagkakaproblema po tayo ngayon in tracking the number of cases that are being documented. This has been pointed out, and government naman through the DOH and the DICT is trying to address this issue, their recent moves the past few days. Ang dream po namin is these experiences that we are now having will actually serve as a wake-up call, not only to our policymakers, but also to our local government units. Devolve po kasi ang ating healthcare system. So, this divide between this fragmentation po of our healthcare system, wherein we have a national Department of Health na technical po ang and regulatory, pero ang ating operationalization po ay nasa LGU, medyo may problema po yun. Another fragmentation in our healthcare system is the private and the public division, no? We all know na Majority of our hospitals are privately owned. And for the longest time, ang ating pong healthcare system has been a free enterprise. Hindi po siya tulad sa ibang bansa na it is a socialist form of healthcare system. Another thing that was exposed, which is number 2, was the need to strengthen our primary healthcare system. For the longest time po, napaka-curative-centered or hospital-centric ng ating healthcare system. In fact, at the beginning of the COVID response, the notion that the hospital was the front line ang palagi nating naririnig. Hindi po totoo yun. The hospital is the last line of defense. The real front line po is the community. Nasa ating pong mga kamay ang susi para po mapigilan natin ang pagkalat ng COVID. That is why we need to improve the health education or the health literacy of our people so that maiintindihan po nila kung ano yung role na sinasabi ni GR kanina na kaya nilang gampanan para po hindi po lumaganap ang COVID sa ating bayan. Tapos po, kailangan din pong maging we will be able to create a safe environment so that patients, when they feel something, when they feel a symptom coming along, they would not be afraid to self-report. Ang nangyari po kasi, parang nagkaroon po ng stigma na ang ano kasi is, pag nagka-COVID ka, parang ikaw yung nagdala ng sakit sa komunidad. When in truth po, nahawa din lang naman kayo. Di po ba? Hindi nyo naman po kasalanan dahil hindi nyo naman po alam kung paano kayo nahawa. So, kailangan po nating ma-educate ang ating mamamayan kung paano po ang pagkalat ng COVID, paano po ito nagdudulot ng sakit. Nang sa ganun po, ang ating health-seeking behavior ay improve po natin. Okay? Kailangan po natin itong maintindihan. Kasi according to the WHO scientists na nabasa ko po kanina, it may take years para po bago magkaroon ng vaccine o ng tamang clinical protocol. Baka din po siya maging katulad ng HIV/AIDS na hanggang ngayon ay nandito pa sa atin. So hindi po natin alam. Baka COVID might be here to stay. So we need to strengthen our public healthcare system. We need to strengthen disease surveillance, and we need to let our patients understand the important role as explained by GR earlier. Primary healthcare po, with its emphasis on disease prevention, health promotion, and disease surveillance is the linchpin to this fight. And lastly, yung COVID also highlighted the social determinants of health and disease. Nakikita po natin na pag may isang heavily congested area na nagkakaroon po ng COVID, madali pong kumalat ang sakit tulad po nung nangyari sa Barrio Luz sa Cebu. So, dahil po ang mga tao doon, ang mga bahay nila magkadikit-dikit, wala po silang access to safe water. So, napakadali po ng disease transmission. Ito pong mga social determinants of health na to ay matagal na po natin tong problema. Ngayon lang po siguro natin mas naiintindihan kung bakit po health, hindi lang po siya concern naming mga doktor o ng mga healthcare workers, kundi po concern po siya ng lahat. Health is political po. Napakalaki po ng role ng politics on health. We must also understand that ang ating mga kababayan po na nasa laylayan ng lipunan, we are responsible for them. We are definitely not in the same boat kasi po, iba-iba po yung ating kalagayan sa buhay. Iba-iba po ang ating estado. Kaya, hindi po natin pwedeng sabihin pipikit na lang po tayo at kakalimutan po natin na meron po tayong mga kasama na mas nangangailangan ng tulong. So dapat po talaga, we should be more mindful and we should be more conscious of our responsibilities to our brothers and sisters. So sana po, ang mangyari sa atin, COVID-19 will serve as a driver for universal healthcare. Lahat naman po ng mga we choose to see po yung organization po namin, the Philippine Society of Public Health Physicians. We choose to see this event, this disaster, as an opportunity for universal healthcare. Yung mga programa po ngayon on recruitment of healthcare workers, strengthening the supply chain, improvement in healthcare facilities, establishing the healthcare provider networks, referral systems. These are all components of universal healthcare. Sana po magtuloy-tuloy ito because we believe that these responses, such as the clinical algorithms, service level allocations, healthcare provider networks, contact tracing through the births, which is community-based, can be used in the future as building blocks for the achievement of universal healthcare of the country. Sana po isipin na lang natin na yung COVID experience natin, ito po ang dress rehearsal natin for universal healthcare. Ano po ba yung central sa universal healthcare law? Ang sinasabi po sa universal healthcare law, dapat may quality care, mayroong equity, at may financial risk protection. Paano yun maa-achieve? Maa-achieve po yan sa pamamagitan ng bawat pamilyang Pilipino ay meron pong nag-aalagang primary care provider who can address their healthcare needs and who can provide population and individual-based services. Universal healthcare is patient-centered. And since ang Pilipino po ay nagpapahalaga sa pamilya, it should also be family-focused. And it should be community-oriented. Nakapaloob po sa batas na ang pagbibigay po ng pagkalinga at pag-aalaga ay hindi po minsanan, kundi it should be a continuing contact. There must be a lifelong relationship with patients, families, and communities, and with the healthcare provider. The care that should be provided for them is comprehensive. Ibig sabihin po, hindi lang sa curative, kundi kasama din po ang wellness, kasama po ang prevention, holistic care po siya. At kung kailangan po niyang matingnan ng ibang profesional o iba pong mga serbisyo, ng primary care provider po niya ang magko-coordinate ng care na yon. At ang konteksto po niya, sinasabi ko po, should be patient-centered. Naka-focus po siya sa tao. If you look on the right side of my slide, andun po yung framework ng person-centered care. On the orange box po, andun po yung care for the staff. So, wag po kayong magtataka, next slide, kung pag nagpunta po kayo ngayon sa clinic, meron na pong pagbabago. Ito yung magiging new normal. Naghahanda na po kami ngayon. May mga doktor na nagkiklinik ng mga konting pagbabago po sa aming clinic. Clinics now will be by appointment kasi ayaw po namin na magkaroon ng maraming tao na maghihintay sa waiting areas at baka po maghawa-hawa kayo. Siguro po pagpasok ninyo sa clinic, makikita nyo naka-cubicle na po yung inyong doktor at meron pong mga kailangan kayong maghugas ng kamay, meron pong mga foot bath, at meron pong maraming mga pagbabago sa loob ng clinic. At baka po yung doktor nyo naka-full PPE na parang astronaut ang dating. Kasi po yan, lahat po yan ay para po protektahan kayo at protektahan din po namin ang aming mga sarili para po tayo po ay maging ligtas sa COVID. Ito pong lahat, kung tayo po ay maipapasunod po natin ang nakapaloob sa Universal Healthcare Law, tayo po dapat ay magpaparehistro sa isang primary care provider. So, ang bayad po nito will be through capitation. So, the cost of care will be covered by the PhilHealth Law. So, sana po yun po yung maging pagbabago dahil may nakita din po akong tanong dun po sa ating Q&A kung saan meron pong nagtatanong si Mr. Mansueto Ordonez, kung magmamahal po ba ang gastos sa healthcare under the new normal dahil po sa mga pagbabagong kailangan naming gawin. So, titingnan po natin, sana naman po hindi. Kasi kung capitation po siya, ibig sabihin po lahat ng primary care needs po ninyo ay covered na po ng capitation fee na ibibigay ng PhilHealth, which is good for 1 year. Next slide po. Another thing that will change in the new normal is the maximal use of information communication technology in healthcare. This will include the use of digital technology such as chatbots, mga chatbot po, web application, and even artificial intelligence. Tapos po, nagpa-practice na din po kami mga doktor ngayon on telemedicine. Baka po Meron din po yung mga electronic prescriptions and a lot of other things. Pero ang pangarap ko po, sana bumalik po tayo sa panahon na meron po tayong home care or home-based care. Okay, so next slide. The bigger challenge actually, next slide, is the push and pull between the economy and health in the face of this pandemic. This will continue to range as governments will try to find ways to finance the Sustainable Development Goals. I would like to share this article with you. It's a very good read. You can access it po online. No? And this graph, next slide, which is a mental model, next slide, developed by a colleague, si Mr. Mike Promentilla. Yung nasa baba po, it's yung sa ano po sa economy. So ito po yung ano natin, we need to manage the risk po of COVID. And at the same time, develop our resilience. How do we develop our resilience? It is by actually strengthening our healthcare system and also making communities empowered and engaged in this fight. It is only through community engagement na pag ang ating kapwa Pilipino po ay naiintindihan nila ang kanilang role sa laban na to, and that they will be more cooperative in all the government's efforts. It's the only way that we can actually survive this together. So tanungin niyo po ang inyong sarili, ano ba ang ginawa ko nung nagkaroon po ng lockdown? Ako po ba ay nainis? Ako po ba ay natakot? O wala, parang hopeless na lang, sige susunod na lang ako. So my second to the last slide, all of those feelings po na naramdaman ninyo are normal because this lockdown actually is the world's biggest psychological experiment. And they say that about 45% of people all over the world have been affected. Meron po talagang mga issues on mental health that has been identified, and this can result to like PTSD or anxiety disorders later on. And I just hope that government are mindful of this and shall include this in its recovery plan. So lastly, and this is my last slide, I quote the Black Swan theory. And I really hope that we can use the data from this crisis to plan for future events. And we would identify what worked best for us and make it part of our values permanently. And by that, what I'm trying to say here is, I hope that this lockdown has enabled us to see what is really important are the things that are invisible to the eye, as what the little princess said. It is love, it is family. Thank you and good afternoon.
Thank you so much, Dr. Aileen.
Thank you.
Thank you po. Yeah, indeed, COVID-19, COVID-19 is a wake-up call on health system, on primary healthcare, and our universal healthcare and the health equity. Maybe it's something that the progressive groups, the civil society can look into, bantayan yung implementation ng universal healthcare para ma-achieve natin yung kanyang napakagandang vision. Before we go to the second part of the program, we will take a short breather. Pwede kayo mag-toilet break, get your coffee, kaya drink your water, ang init ngayon. And when we come back, we will get the reaction from another doctor who's already familiar to most of us. But in the meantime, let's all have a 2-minute break. I'll see you after 2 minutes.
Pahinga sa panaginip kay liligaya, darating din ang umaga. Basta tayo magkasama, laging mayroong umaga. Kay ganda pag sikat ang araw, may dalang liwanag sa ating paghaharap. Oh, mahalin natin. Simple lang, sama ka naman. Kung ayaw nila, sa akin okay lang. Hindi mo makuha sa tingin gaano sa taas kung ayaw pa rin Missing na araw ng pag-asa'y narito na dumating din harapin natin
Okay, welcome back. This is still life after the pandemic, facing the new normal, a special webinar series on COVID-19 outbreak brought to us by the Active Citizenship Foundation. And this episode, we are joined by the doctors from the Philippine Society of Public Health Physicians. Now, our session's reactor for this afternoon will weigh in the discussion. He's already very familiar to most of us, sabi ko nga kanina. He's the chairperson of Akbayan Youth and the founder of Youth for Mental Health Coalition. Let's all welcome Dr. RJ Naguit. Hello, Doc. Good afternoon.
Hello, magandang hapon po mga kasama. So again, I'm Dr. RJ Naguit from Akbayan Youth. And of course, ako po ay isang general practitioner na ngayon ay nag-aaral rin ng community development. So siguro doon natin i-frame yung magiging reaction ko. And first of all, gusto ko magpasalamat kila Doc Aileen at Doc GR. Sila yung mga boss ko sa Philippine Society of Public Health Physicians. And napakaganda ng discussion because it actually summed up yung interventions that we can do at an individual level up to the community level and at the macro scale. At kanina merong mga binigay na information on what we can look forward as we transition to the new normal. So siguro to start my reflection on this, yung una pong gusto kong i-highlight is nakita na rin dun sa discussion, no? So from the individual, kailangan nating i-shift actually yung conversation to also the community as a point of intervention. Kasi kung makikita po natin, and if you would look at the social ecological model, makikita natin doon na yung individual ay hindi pwedeng ialis dun sa community, and all of the actions of the individual are shaped by the community where the person is. So napaka-importante talaga na tinitignan po natin ano yung mga social cues natin, and we also get to normalize yung mga tinatawag nating health promoting behavior. Kumbaga, pausuhin natin yung mga health promoting practices. So yan yung mga magandang tignan natin. And of course, in terms of working with communities, napaka-importante rin na ma-recognize natin yung inherent na expertise ng ating komunidad. Kasi minsan, syempre, pag kunwari, it's very expert-led, nagiging top-down yung approach. And sometimes it doesn't really sit well at hindi siya nagiging appropriate. Ayan, nandito pala si Doc Lester. Hello pa, Doc Lester. Ayan, so nagiging hindi fit yung mga interventions that we do. So we have to recognize na yun nga, meron tayong mga technical experts, pero at the same time, meron rin tayong experts by their own experiences. At napaka-importante na pagbanggain natin yan in terms of mapping out ano yung mga interventions na gagawin natin. And of course, importante rin na we start where the people are. Siyempre, very basic naman yan in terms of health education, lalo na kung behavioral change yung gagawin natin. So, simulan po natin kung ano yung ready sila i-adapt, tapos later on, mag-build on tayo following yung scaffolding model of health education. Yung pangalawang punto po na gusto kong i-raise ay yung tinatawag nating intersectionality in terms of health. At yan din po yung isang pinunto ni Doc Aileen na hindi hiwalay ang health issue sa ibang mga concerns or social concerns na kinakaharap natin ngayon. Napaka-importante ng politics, pero at the same time, napaka-importante rin na pag-usap about culture, no? For example. So, I know globally napakalawak ng pag-uusap about health in all policies. Pero again, my question is parang paano ba natin to ginagawa? Paano natin siya i-operationalize sa ating model ngayon? Meron na ba tayong mga meron na ba tayong mga resource person na tumitingin sa mga health interventions natin coming from the different sciences? So, maganda rin nating ilagay yan. Kasi, syempre, we can talk all we want about the health and all policies, pero unless wala tayong infrastructure to do it, then it won't really happen. So, again, kailangan natin i-address yung issues of stigma, discrimination, inequity, no? And of course, gusto ko rin i-highlight, which is something also very close to my heart, is yung power dynamics between the clinician and the patient. Kasi of course, pag pumunta sa hospital, kahit anong sabihin ng doktor sa'yo, minsan yung mga hospital na pupunta, parang sinasabi nila, okay, yes po doc. So parang hindi nagkakaroon ng adequate time para magbanggaan ng information yung clinician and the patient. And I think in terms of promoting the best form of quality of care or the most highest form of quality of care, napaka-importante ng collaboration between the patient and the clinician. Pero syempre, maraming mga power dynamics that also needs to be addressed alongside that. So again, balik ko lang din yung importance of social sciences in terms of how we deal with this. Kasi napaka-importante ngayon, we have data science experts, we have researchers, pero I think yung implementation ng mga interventions na pinopose na based on science ay dumedepende rin sa social sciences. So for example, governance is part of the social sciences. Risk communication, psychology, anthropology, lahat ng yan ay parte pag pinag-usapan po natin yung health. And of course, the bigger call actually is to humanize health na balanse ang scientific side as well as the social sciences side. Yung third siguro ay yung tinatawag po nating intentionality. Kanina na-bring up po yung issue about universal healthcare. But then again, kailangan din natin po maintindihan na hindi lang naman natin gusto na coverage for all, but it's a way of redistributing yung resources na meron tayo to those who need it more. So meron tayong nakikitang concept of social solidarity na nakikita natin in a way, although inaano pa rin siya, inaayos pa rin how to implement it doon sa UHC. Ano rin siya, parang question rin siya on sino yung mga sector na nako-cover. Kasi right now, of course, marami tayong mga general guidelines. Pero sometimes, in terms of mapping out yung equity issue, kailangan natin maging deliberate siguro in terms of mapping out ways on how to protect also those who are, for example, hindi masyadong napag-usapan na sector. Like for example, yung mga nasa prison, for example. So wala pa akong masyadong nakitang guidelines about health in prisons sa mga nasa psychiatric institutions. At marami pang mga sector na kailangan marinig in terms of plano sa health sa kanila. Fourth siguro is a reimagination, of nasabi na ni Doc Aileen kanina, yung mga physical rearrangements that we need to do in our clinics, yung use of digital technology and telemedicine. These are very promising na pwede nating i-adopt. But then again, maraming mga issues pa rin on the safety, security, kasi syempre gusto pa rin natin i-highlight na una sa lahat yung confidentiality ng information ng mga pasyente, and at the same time hindi siya also nagagamit to actually coerce people into doing things na hindi nila gusto. And question rin na paano natin i-apply yung empathy, especially kung yung mga doktor natin balot na sila ng PPE at hindi mo na makita yung mukha nila. So I saw a tweet na ganyan yung sinasabi. Nakalimutan ko lang kung sino, pero taga PGH siya. Pero sinasabi niya na parang hirap raw siya mag-convey ng human touch doon sa pasyente niya dahil nga naka-cover siya. So again, with all of these technologies, napaka-importante na how do we still maintain yung human touch na I think napaka-importante sa ating mga healthcare professionals. So siguro yung pinupunto ko lang with all of my inputs today is yung konsepto ng democratizing healthcare. So it's already a question on who practices healthcare, when it is practiced. So ibig sabihin hindi lang dun sa parang merong diagnosis na, but also on the preventive and promotive side, and where it is practiced as we now transition to the new normal. So yun po yung mga inputs ko so far. Thank you, Kuya Alvin, and thank you po sa nag-input si Doc Aileen tsaka si Doc G.
Thank you, Doc RJ. Alright, sige, ang dami na nating questions. Actually, hindi ko alam kung anong uunahin ko dito. But siguro let's begin with packing the community quarantine, Kasi this is very important. Ako, for example, hindi pa ako lumalabas in the past, 50 days plus na siguro na akong hindi lumalabas. So, what would be the cautious conduct under a general community quarantine? Or wala ng GCQ, the new normal, habang wala pang vaccine, what would be the cautious conduct for ordinary people in a new normal setting when we gradually get back to work, when we gradually get to travel again, etc.?
I would answer the question, Una, you must think of yourself as vulnerable. So, pwede kang mahawa. So, therefore, you need to protect yourself. You need to wear a mask and you need to be at least a meter apart from another person. So, physical distancing should really be practiced. And then, second is, hindi mo rin alam, baka nahawa ka na, pwede kang makahawa. So, kailangan, as what GR said, you should observe cough etiquette, diba? So, yung kailangan mong iisipin is, protektahan ko ang sarili ko, protektahan ko din ang kapwa ko. So, those things things. So we have to be mindful of basic hygiene. Paulit-ulit na namin sinasabi, paghugas ng kamay. Kasi po, ang virus, wala ho yang paa. Hindi ho yan makakatransfer sa ibang tao. Kailangan po niyang ihatid ng ating mga kamay or ng fomites, for example. So, like your cellphone. Yung cellphone mo, ganito, iniiwan-iwan mo kung saan-saan, tapos may dumikit siyang virus, hinawakan mo siya, tapos hindi mo alam, nandun na pala yung virus, hinawakan mo rin yung bibig mo or ilong mo, so inintroduce mo na ngayon yung virus sa loob ng katawan mo. So yung mga we will have to change our practices and our habits to be more mindful of basic hygiene. Wala yung naalala nun sa nanay ko, wash your hands. So, parang ganoon na nga, palagi na tayo, wash your hands. So, may dala ka ng alcohol, palagi ka ng naka-mask. So, pabunggahan na lang to ng mask pag na. So, kaparte na siya, hindi na, kilay is life. Wala nang lipstick, kilay na lang and mask. Yun na yung, ngayon, fashion statement. Yun, from my point of view, yun ha. GR, ikaw.
Indadagdag ko rin yung parang kailangan rin nating i-weigh yung risk. For example, okay na mag-travel, pupunta tayo, ba natin magpunta sa beach, gano'n ba yun importante? Kung yung mga bagay na hindi naman importante, why would we risk it? Parang kung kaya namang mag-grocery once a week, bakit kailangan ba na everyday kailangan magpunta dito sa grocery or kung bukas na yung mall, wala kang bibilhin, pero bakit kailangan bang maglakad-lakad doon, exposing yourself? Parang yung mga ganon. Parang in everything we do, we need to assess, importante ba talaga to? Or I'm just increasing the risk of mahawa ako or makahawa ako sa
and one more thing pala, isipin mo rin yung mga kasama mo sa bahay. Kasi baka ikaw, maganda ang immune system mo, okay ka. Paano yung kasama mo sa bahay? Paano kung may kasama kang matanda or may kasama kang immunocompromised? Tapos so ikaw pa yung naghatid sa kanya, nagbibigyan mo pa siya ng virus. So a lot of things, no, na mga pagbabago talaga on the way sa lifestyle natin.
So kumbaga hindi lang yan maiiwan at this point, naka-quarantine tayo, but when we gradually commence to get back to work, etc., kailangan pa rin natin intindihin wearing mask, physical distancing, and of course yung welfare ng ating sarili at ng mga kasama natin sa bahay. I have here clustered questions on the healthcare system, on universal healthcare, etc. Pero parang later na lang yun kasi unahin ko na lang siguro muna itong mga mabilisang questions lang. Like for example, everyone in the panel, right? Hi, Dr. Lester. Hello. Dr. Lester is here with us, joining us this afternoon. Also, Dr. Lester is the president of Philippine Society of Public Health. Dr. Lester, if you want to weigh in, just turn on your microphone. Unahin ko lang yung mga mabilisang questions lang dito. For example, are seniors daw ba are really more vulnerable to the virus than those belonging to other group? Parang kailangan natin i-confirm yan.
Yes. Several studies already support that yung pagiging elderly really puts you at a high risk. Tapos isa pa, compounded pa yan that most elderly population have comorbid conditions. So, being elderly alone is already a high risk. It's already a risk in itself. Age in itself is already a risk. And then compounded pa siya ng existence or coexistence of comorbid conditions like hypertension and diabetes, cardiovascular disease. So, dumudoble yung risk mo. So, yes po.
Okay.
Talaga pong age by itself is a risk factor.
It's a yes. Earlier, I think sa presentation ni Doc GR and then sa reaction din ni Doc RJ and kay Doc Aileen, we've mentioned about health-seeking behavior. No? But the question is, how do we promote this? Especially doon sa mga areas or community na poor and marginalized. How do we promote health-seeking behavior?
Well, etong dun sa, actually, part na rin yan dun sa, isama ko na rin yung regarding sa stigma. First, yung the manner on how we provide information. Mas ang preferred is short, concise, and factual information para we should not layer, hindi pwedeng nananakot or yung tipong sa flip side naman yung parang dinededma mo naman yung issue. So, facts, give the facts, and also engage yung mga, sino ba yung mga leaders dito sa community na to. Maaaring hindi politicians, pwedeng religious leader or merong elder doon sa, especially sa mga, hindi may mga elder doon na yun yung pinapaniwalaan. So, kailangan mo talagang directly engage itong mga leaders nila to really push yung kung ano yung gusto nating ipahiwatig sa ating community. And also, ang part rin sa health-seeking behavior is yung access. Kailangan talaga nating rin to improve access nila. Baka kailangan natin alam, bakit ba sila hindi nagpupunta? Kasi walang mag-aalaga sa bata. So, kailangan may magkaroon ng way para hindi yun maging barrier or mga ganun, or walang transportation. So pwede tayong, yung iba may mga ginagawa, parang nagkakaroon ng parang volunteers na maghahatid yung sa mga pasyente towards health facility. May mga ganung mga out of the box thinking pwede yung kailangan natin.
I think si RJ ang mas makaka-comment dyan.
Okay.
Kasi this is more of a medical anthropology and a social science siya na issue. Health-seeking behavior kasi is greatly affected by health literacy and previous experiences with the healthcare system. So kung ang previous experience mo with the healthcare system is not very pleasant and you feel that it's not a safe space or a safe environment, medyo mahihirapan talaga tayo on improving the health-seeking behavior. And if you relate it to Maslow's hierarchy of needs, ang mga tao would always uunahin nila yung physiological need. Kaya ang Pilipino, and I'm guilty of this when I was a younger physician, na pinapagalitan ko yung ibang mga pasyente ko, why they come and malala na yung sakit. And then I realized as I grew older na it's not because they didn't value their life, it's just that they had other more important things to do, like earning a living, and what Jira said, who will take care of the kid, who will take care of the baboy, because the baboy is their main source of livelihood, etc., etc. Wala silang pamasahe. Pagdating pa nila sa ospital, dahil ang sungit-sungit ng mga doktor, di ba? Sana siguro ako doon. No. So, napapagalitan namin. Kami din at fault because somehow we failed to see the human side of the patient. What we just saw was the disease and our desire to cure the disease. We failed to take care of the patient with the disease. And it's that thing, no, na that we need to change even in our medical curriculum. It is focusing on the person, taking care of the patient, taking care of the family, and not just addressing the illness. So it will take years, it will take a lot of time for us to undergo this kind of change in our health culture, in our health-seeking behavior. And I do hope the social scientists be able to help us on this. And doctors like RJ who are also into this kind of discipline would really be a big help in training and educating the future physicians of our country. Tama ba, RJ?
RJ, would you like to weigh in?
Actually, hindi po ako expert on anthropology. Pero based from my experience kasi, working with people who use drugs in the community, parang minsan kasi ilang sila pag-usapan talaga yung issue ng drugs kasi it's highly stigmatized and maraming complications like security issues. Pero siguro, one of the things na napaka-importante po talaga is yung creation of a safe space for them. So, na hindi invalidate kung ano yung mga ini-input nila. Basically, yung doctors should not talk down on our patients. And of course, importante rin po yung developing that kind of deep relationship with the patient para at least magkaroon ng open communication. Kasi sometimes, pag doctors tayo, syempre, ang dami nating patients. So, minsan nakakalimutan natin yung human component. And of course, siguro rin, kailangan natin i-introduce yung mga concepts in a way na relatable sa kanila. So, gusto ko kasing pag-usapan yung issue ng addiction nila during that time or substance use. So, parang relate ko muna siya doon sa use of cigarette, for example, which is also some form of addiction. So, pag sinimulan natin doon, mas madaling i-bridge doon sa mas complicated na issue. So, probably, that's one experience that I've had and siguro pwede nating itry other aspects of health education and behavioral change.
Yan yung context, Alvin. If you remember in my presentation, it was not the usual subjective complaint, objective findings. Merong C. That's the context of the patient. And the C, the context, can only be developed through a lifelong relationship with the patient. That is why binabalik ko sa universal healthcare, importante po talaga na merong isang primary care provider na mag-aalaga, na kikilalanin po ang pasyente. Dahil kung kilala niyo po ang pasyente, mas madali pong mag-interact to someone whom you have developed a trusting relationship.
Yes, but kumbaga creating a safe space for them. At the same time, syempre, yung health education for the communities, yung they have to be yung kumbaga the facility has to be accessible to them para it won't appear like it's a chore going to kung magpapa-check up ka or kung may kailangan kang gawin sa clinic, etc. We've been hearing sa news in the past ilang buwan na sinasabi nila parate, target is no second wave. Parang ganyan. Kasi ang sinasabi nila nung 1918 flu pandemic, mas maraming namatay during the second wave. Ano ba yung what indicates a second wave in the first place? Parang paano natin malalaman na parang, okay, this can be a second wave. Like, na-flatten na ba dapat ang curve and then people went back to their new normal, parang ganyan, before you can go to a second wave. Just so parang everyone's sort of like leveled off on what second wave is when they hear it sa news, etc. Kasi sometimes parang it creates anxiety, di ba? Na parang natakot siya and it's something that we should...
Parang kung ko kami yung parang definition is parang arise yung sudden rise again of cases na pwedeng iba't iba yung pwedeng maging. Kasi kung for example nawala yung napababa mo na. Yung dun sa Spanish pandemic ang kinukuha doon is yung kasi yung Spanish flu is very yung dun sa weather. So nung napababa yung cases because uminit na, so hindi na nag-transmit yung cases, pero nung lumabig ulit, tumaas na ulit. So parang yun yung sinasabi nilang second wave. So parang more of yung dun sa yung number of cases na ang kinukuha dito is ang kinakatakot is yung kapag yung bumalik, rumami ulit yung number of cases to the point na ma-overwhelm yung ating healthcare system. So parang ang kwan dito is hindi parang ang kwan kasi merong fear na ito parang second wave, tataas ulit yung infection. It will not be more troubling if before yung habang kapag ini-increase rin natin yung capacity natin. So that kasi 'di ba ang sabi nga social distancing is not really to eliminate the disease pero parang to flatten the curve in such a way na kaya nang ma-increase natin yung capacity natin. Kaya kakayanin na natin kahit na medyo mag-increase man yung cases. So yun yung nasa isip ko na parang wag lang natin isipin na second wave pero yung mag-focus doon. Pero kailangan rin nating i-focus is in strengthening anong meron tayo para kahit na medyo mag-increase, makakayanan natin. Yung iba, kung anong naman second.
My first question actually, my reaction to that is a question. Have we really reached the peak? Na-reach na ba natin yung peak talaga ng pandemic for the first wave? Before we even talk about the second wave, ang tanong ko ngayon, or did we just plateau in our testing capacity? The target was to do 30,000 tests per day, and have we achieved that? For us to say that we are really getting a decrease in the number of cases. Masasabi mo kasi you're over the hill kung na-reach mo na yung peak at pababa na yung kaso mo. But if you look at the census every day, we're not seeing that yet. So, it's very early at this point in time to say that we have plateaued. We have peaked and we have plateaued and we're going down, 'di ba? Ang challenge naman, the problem is we also cannot remain on ECQ forever because our economy would suffer. So how do we reopen the economy at the same time try to minimize the threat to the healthcare system? That was the graph I showed kanina, yung the risk and resilience graph, the mental model of Mike. It's a very good article, you should read it. Ano talaga siya, no? Their style in Germany was to gradually reintroduce. So parang the non-vulnerable population, yun yung slowly ini-expose nila. The vulnerable population are still told to remain inside the house. I think that is what is in the yung nabago ngayon, yung recently revised IAP, the Incident Action Plan of the National Task Force was to slowly reintroduce people back into the mainstream, but only those who are not vulnerable. Because if you look at the statistics, if you belong to the non-vulnerable population group, 80% actually of infections would be very mild, and you would not need to be hospitalized. So you need to protect those who would have poor outcomes. And this is the vulnerable group. So, and the fast spreaders. So yung mga bata, kaya yung kindergarten, 19 years old and below, hindi sila dapat lumabas muna ng bahay. Kasi sila yung not so vulnerable, kasi nga their immune system is good, but they can be the connectors. Sila yung taga-bitbit ng virus. The vulnerable group, we let them stay inside. So tayo daw, Lester, na nandun tayo sa gitna, pwede tayong lumabas. Pero kailangan lang mindful tayo sa physical distancing na sinasabi ni RJ, no? O ni GR. Tapos, pangalawa, yung self-reporting. Pag may naramdaman kang simptomas, kailangan ipaalam mo kaagad para matitrace ka agad kung saan-saan ka nagpunta at malalaman ka agad natin kung kanino ka nahawa at sino-sino yung pwede mong nahawaan. We need to have a good disease surveillance in place. Una yun. Pangalawa, kailangan community empowerment, community engagement and community empowerment para tayo makapagbukas na and prevent the so-called second wave. Nangyari sa Singapore, they were able to control it, but they forgot a segment of the population. They forgot, sino yung nakalimutan nila? Yung mga OFW workers nila, yung nasa laylayan. And it became the hotspot for the second wave. China, these were the international travelers who came home to China. So sila yung nagdala ngayon. Then in Korea. So you're seeing different pictures na being responsible for the second wave. And us as a country, we are trying to learn from the experiences of all of these countries. In fact, sinasabi nila we have been on longer pa nga tayo than Wuhan eh. Kasi by May 31, that will be our 76th day of quarantine, while Wuhan was only on quarantine for 75 days. That's a lot of So and it has to be contextualized. Kasi yung metrics na ginagamit, the case doubling time, the critical care utilization rate, it has to be at the granular level. So the local government units are in a better position to say when their health system is really ready, na resilient na siya so that they can open up. Take, for example, my home province. I'm from Region 8. It has a population of 4.4 million. We only tested around 4,000. That's 0.1% of the population. And it has not, there was no PCR testing done in all of the towns, in all of the LGUs. So how can you say that it's really zero, that this province is really zero when there has been no mass testing? So ang dami niyang factors to consider before you can say that we have really flattened the curve for the first wave. So let's not go into the second wave. Let's concentrate on the first wave lang muna.
Correct. Okay, Doc RJ, do you have anything to add on to that?
Wala naman po. Okay na po.
Okay. Let's go to the healthcare system. No, earlier medyo na napasadahan na ni Doc Aileen. Right now we already have the universal healthcare law. No? Given that we implement this well, meaning masunod natin lahat ng kanyang pillars, do you think that this kind of healthcare system would be kumbaga a pandemic ready system for any pandemic that would come in the future, given na ma-implement natin ng maayos yung ating currently passed na universal healthcare law? Or if not, how would you characterize a good universal healthcare system?
Ang Miss Universe naman yung question.
Mag-start ka mo. Doc Aileen, mag-start ka muna na. Thank you for the wonderful question.
Interpreter, please. No, the universal healthcare law is far from perfect. It is far from perfect. And implementation would be very tricky. And it would be characterized by a lot of hardships and a lot of problems in the past. No country has been able to do it perfectly at one go. And in fact, countries all over the world are still trying its best to tweak and make the system work for them according to their context. So to say that it is the cure-all for everything would also be unfair to the framers of the law. But suffice it to say that if the components of the universal healthcare law would really be in place, we would have a better chance during times of disaster. Yun naman yung pagka-frame niya for it to be resilient, especially in times of great need, such as in disasters and emergency. Okay? A public health emergency of this magnitude, a pandemic of this magnitude only happens every 100 years. Diba, Lester? For history natin, national health, global health, a pandemic of this magnitude doesn't happen every day. So we don't know in the next pandemic, because definitely we were not here in the Spanish flu. I don't think I would be here in the next time. We don't know what it would bring, but hopefully our system would be better prepared then. Sana yun lang yung yun lang ang prayer ko. And I thank you.
Doc GR.
Looking at the G's, kasi in terms of kung ano magiging how universal healthcare will look in the Philippines, that's still hindi pa talaga alam. Pero at the very essence of universal healthcare, kung ito-trace natin yung history niya, for example, NHS ng UK, it was brought upon because people understand na in terms of yung mga ganito calamity or something, kailangan magtulungan. Walang hindi apektado, hindi lang mahirap, hindi lang yung mayaman, pati yung mahirap, mas lalo na yung mahirap. So parang solidarity ba? Social solidarity. It's an act of social solidarity. So kung if ever, ganun yung magiging system natin, wherein the rich, all of us care for each other, the rich will care for the poor, and everyone will help. I think meron tayo mas mataas ang chance natin to weather this kind of calamity compared to a system.
Meron na.
Compared to a system wherein yung parang kanya-kanya, more of out of pocket, kung walang social support, kung mahirap ka, wala kang pambili ng gamot, sorry ka. So parang yan nga. I think if we make UHC work, it would be beneficial in the long run.
And in
Mag-comment
relation to that, yeah, Doc Lester, yes po.
Yeah, mag-comment lang ako. So thanks a lot, and echoing also, I agree with both Ma'am Aileen and Doc GR. Na-mention na rin nila several times kasi ang, behavior, personal, and even primary care level. UHC actually was, yung most of its content is not like super directed for pandemics like this, and most of its contents actually is on financing, health promotion, and primary care. Yung advantage in a way na nangyari ang pandemic, ang COVID, is because habang inaayos natin ang IRR, ang implementing rules for UHC, we can adjust it, kasi because of this experience. So it will teach us a lot. And history naman has shown that any big disaster or emergency, even Spanish flu, and even previous to that, and anything big that influences us, it will give us a chance to reflect and improve what we already have right now. Hopefully, we can work together. Yan lang.
Okay po. And in relation to this, earlier nasabi ni Doc Aileen, our healthcare system is actually devolved, And more often than not, ito yung nagiging issue or difficulty in a lot of instances, yung kumbaga, yung ibang LGUs, they will not prioritize health, for example, mababa yung kanilang budget on health. Do you think there's a need for rearrangement on this, like re-centralizing the healthcare system para maiwasan yung fragmentation? Or how can, for example, the current universal healthcare law remedy this particular situation on the fragmentation?
The universal healthcare law talks about healthcare provider networks. So I think that's already a step towards addressing the fragmentation of healthcare. Yung devolution naman, the framers of the devolution really took heart the Alma Ata Declaration of health being in the hands of the people. So, kaya siya din-evolve actually. Health kasi should really be in the hands of the people. Kasi tayo yung we should be the rightful owner of our health, and there should really be community empowerment. So, we also need to do electoral parang literacy ng voter literacy, so that we would not be tempted to put our healthcare system in the hands of the wrong people. So it goes hand in hand. We need to really elevate the consciousness of our electorate so that they would elect the proper leaders. Kasi yung lumalabas talaga dito ngayon, leadership and governance really has a big role to play in having a very good healthcare system. And also, there are trainings being conducted din like through the Zwilig Family Foundation, for example, na yung bridging leadership, so that they would also be able to influence a lot of local chief executives to understand the important role of LCEs, the relationship between the local chief executives and the municipal health officers. Ang kailangan kasi natin talaga dito is participatory governance. And in a country like ours that is an archipelago, tama din naman na hindi siya masyadong Manila-centric. Hindi siya centralized. Kasi sabi nga ni RJ kanina, bawat isla, bawat rehiyon, may sariling konteksto. May cultural nuances, mayroong geographical nuances na mas maa-address talaga siya if healthcare is really devolved. Ang kailangan, we have stories naman of success, of best practices of local government units. Hindi naman lahat horror story. Meron din namang parang best practices na ma-share natin from it.
Nagdagat ko lang rin na parang hindi kasi yung sabi, yung framers of devolution, yun yung palang idea. Kasi tama naman na kapag kasi ang kagandahan ng devolve, mas gamay mo kung ano yung nasa ground. So kung kailangan ng ang problema ng community mo is sabihin natin more of leptospirosis. So kailangan mong mas mag-focus doon compared sa, for example, ang national program is TB program yung pinupush. So ang problema rin kasi is yung parang may times kasi yung mga LGU, even napakatagal na yung devolution, hindi pa rin nila na-own na part ng kanilang responsibility ang health. Nung DTTB ako noon, may one time sa isang meeting sinabihan ako na parang ng budget officer, bakit kayong mga nasa health, kayo na ngayong inampon, kayo pang raming hinihingi. So parang 20 years, or more than 20 years na ago ang devolution. Pero may mga iba pa rin na na-feel na ampon lang yung health, na hindi talaga siya part ng responsibility ng LGU. So may mga ganong kailangan nating i-fix in order na kahit na may devolution, it works for our setting.
So it's a yes, okay ang devolution in a sense that, you know, because if it's your territory, you know your territory very well. But at the same time, of course, LGUs, maganda siya kapag priority siya ng LGU, di ba? Like, if it's the main agenda of the local government, where you are.
I think ang nito is, kasi for example, di ba ino-orient, yung parang kapag LGU ka, LCE, merong mga functions na talagang ingrained na sa'yo na kapag LCE ka, part ng trabaho mo, part ng tinitingnan mo ay ito, economy and con. So, kailangan lahat ng LCE ingrained na kapag pumasok sila as LCE ng kanilang community, part and parcel ng kanilang work description is sila yung parang part yung health doon. Hindi siya parang pasintabi lang or just for the sake. So parang yung mga ganun. Kaya we need to capacitate these LGUs to really equip them with skills and knowledge so that they magawa nila yung kung ano yung kailangan.
Kumbaga, like pass yung appreciation towards health improvement. And it won't appear like parang it's additional chore for them. Doc Lester?
Yeah. One of the beauty, alam ko ang decentralization is a given for the last 25 years. And one of the beauty siguro of decentralization is it actually gave a lot of capacity then by law, by design to LGUs to be creative, to be innovative, to work. Ang problem lang is syempre in terms of capacity and creativity, baka yun yung kailangan i-build. I will not talk too much on the health sector kasi alam niyo na ang lahat na problema on that. But one of the things na kailangan din nating encourage at ituro is actually the how LGUs can actually mobilize funds and be more efficient in using funds for health and for other sectors. Kasi yun yung magiging, I mean, ang dami nating wish list sa health, sa totoo lang. Pero syempre, resources are also limited. So yun lang yung very quick na kailangan isipin. And if LGUs can actually be more efficient in terms of, and creative, in terms of generating local income, local revenue, it can help a lot. Kasi the winners naman of decentralization are LGUs na who have lots of resources in general.
Yeah, Doc Lester, follow up on that lang.
Yes, go ahead.
So, you know, healthcare has been devolved for quite a while now. Do we have like success stories in relation to health outcomes? May mga success stories ba tayo in relation to health outcomes nung din-evolve natin yung health system?
Sa ngayon, wala akong makita na actual success stories, pero I think a lot of the discussion this afternoon has also been on, you know, behavior, on personal health-seeking behavior, culture. So it's very difficult na just because of decentralization, you win or you lose. Kasi ang dami-daming variable factors. So it's difficult. But again, in general, marami naman sa mga usually resource-rich ang maganda ang ano nila sa implementation because may resources din sila. Now, it doesn't also mean na kung may resources kayo at maganda yung input for health, maganda immediately yung magiging outcome kasi it also takes time. And yung challenge actually na ngayon tinitingnan, there are NGOs, there are groups actually that focus a lot on, you know, building the LGU, building governance in the LGU, especially on the health sector para maintindihan kung paano to gagawin. Hindi ko na i-mention. And yeah, that's a good question yung looking for positive health outcomes. I'm sure naman meron. Many times kasi hindi lang naman health outcomes ang minimeasure. It needs a lot of us actually work on research para maipakita ito at makita kung ano yung best practices actually in terms of I think RJ has comments din.
RJ.
Of course, I'd like to start off na parang, of course, hindi ako expert pa on the health system and of course, yung UHC is something na inaaral ko pa. Pero yung discussion actually on decentralization actually makes me think of ano yung role ng national government. Kasi kanina maraming mga pinag-usapan about how to increase the capacity of the LGUs individually. Pero yung question siguro ng sa national government is how do we make sure na yung serbisyo na nakukuha in a remote island in Mindanao, for example, will be somehow the same doon sa nakukuha natin sa mga urbanized city. So, syempre, parang nag-ooperate ako dun sa framework na, of course, hindi naman pwede na dahil low-class municipality ka, i-accept na lang natin na less na yung services or lesser quality na yung services na makukuha mo. So parang yun yung iniisip ko right now. Ano yung role ng government to redistribute its resources and channel it sa mga mas konti yung resources para at least maging somehow equal yung access to health ng mga Filipinos. And siguro maganda rin explore. And I think may mga models naman before on how LGUs actually work together para magkaroon ng ways na ma-increase yung capacity nila. Kasi very evident yan, especially now na nakikita natin na yung health situation ng isang area would actually have effect dun sa health situation ng karatig na lugar nila. So probably yung mga experts natin dito can also discuss more on that. Ano ba yung mga ways or ano yung mga experiments that were done before na pwede nating i-review, balikan, and i-campaign if ever.
Comment lang ako kasi sorry, I think this is about to end na rin. And ako din, kailangan ko lang rin umalis. There is a term, risk adjustment, that is being used actually in health financing. Actually, part na rin po ang risk adjustment sa UAT. Yun yung tinitingnan at a policy level, tinitingnan natin. Pag mas high risk ang area, pag mas malayo, pag mas remote, may add-on ka na factor. So yun yung part, actually part talaga yun ng UHC, and we are doing our best din para ayusin yan. Pero even before that, we have concepts like nurse deployment program, we have the GIDA concept, and the DTTVs. Those are actually part of programs na in a way, ina-ensure mo yun parang gap filling. Kasi even in other countries, rich countries, Australia, US, in Europe, Scandinavia, pag medyo malayo na talaga at remote na, national government actually puts more resources or would send parang DTTV version nila. So, may mga ganun talaga yan. And tama naman ang lahat na those that are well-resourced, yun yung mas madali. Pero there will always be those that will fall off sa margins. So, yun yung inuuna. And as a country, I think we are also already learning that kind of strategy. Thank you.
Thank you, Doc Lester. Sige, let's try to elaborate lang siguro very little on that. Kasi na-mention na rin ni Doc Lester, yung how do we bridge ba the rural and urban health gap in emergency situations like COVID-19, for example? Kasi earlier, di ba, Doc Aileen, earlier na-mention mo, parang in your region 7 or region 8, parang may mga areas talaga na wala namang na-test. So how would you say na zero talaga yung cases doon? So, kumbaga, ano yung dapat nating ma-prioritize na ma-set up doon sa mga far-flung area in emergency situations like COVID-19?
For specific for COVID-19, we really need to have the testing capacity. That's one. We need to have the testing capacity so that we would be able to do local testing. It would be impossible to do mass testing. We cannot test 109 million Filipinos. That's impossible. Maybe targeted testing using RT-PCR can be done. Parang aided with immunoprevalence studies just to document, and also seroconversion. Kasi we also need to see kasi like the use of antibody test kits, for example. You can actually use them, but not for clinical diagnosis, but to establish immune prevalence in the community. So marami kasing pwedeng gamitin na public health tools that we can actually use to have a clearer picture. Then second is having a real-time reporting system. Yung parang may dashboard ka na nakikita mo talaga, and the data is really solid, really accurate, verified, and reflected siya real time. Kasi it's through that you would really have knowledge-based na decision-making, diba? Makikita mo talaga na your decision is based on evidence, and it's not based on something na hinugot mo sa hangin. Then, the ability to isolate and trace. So, meron ngayon like applications that we can use. There is so much power in getting the right information. This is now the age of the fourth industrial revolution. The fourth revolution, not the industrial revolution. The fourth revolution, wherein the new currency of power is information. So, if we have that real-time reporting system, we can actually weaponize that data. Magagamit natin yung data na yun in in order to make good plans on how to address this issue properly. It can guide us, for example, kung saan ba dapat mag-build ng isolation facilities. How many beds do I really need to have based on a computation of the attack rate? Based on this, saan ba yung probable next hotspot ko? Saan pa pwede akong magkaroon ng problems for border control? All of those things, you can put in a layer of GIS, for example, geo information systems, geophysical mapping, a lot of those things. What we have right now in terms of digital information is so much more than what was available nung pandemic flu. So talagang we can use a lot of those things as a public health tool. And we did a webinar on that with another organization over last weekend. We discussed it, and Lester was one of our discussants. So, pwede talaga siya.
Okay, we're supposed to end siguro in 3 to 5 minutes. Mabilisan lang. Because this is a hot topic in the past days then. Everywhere, in social media, sa news, etc. It's becoming an elephant in the room. With the new extension, there's another 2 weeks we're ending the community quarantine ng May 31 before we transition to GCQ. What does this mean for all of us? Ano yung binibilhan natin ng oras for this? Some would say it's the implementation of mass testing, etc. Ano bang ibig sabihin nito for most Filipinos na under ECQ pa rin? Like why are we keep on extending?
Ang tanong ko dyan is, handa ka na ba? If we lift the ECQ, handa ka na ba? Handa na ba tayo? Are we ready? If your answer yes, you're ready, then maybe we can really lift the ECQ. Are we ready to follow the rules? Are we ready to protect ourselves and protect others as well? Is our system ready to take care of the vulnerable? Do we have access to medicines? Do we have access to PPE? Do we have access to all of that? Are we ready? How ready are we? Yun lang yung ko dun. If we're ready, then we lift. Kaya nga sinasabi ng IATF nung Tuesday ba yun na it will be up to each LGU to decide and evaluate in their readiness. And then they can appeal to the IATF kasi some of them were classified as low risk, moderate risk, high risk. Then look what happened. A lot of LGUs submitted an appeal that they were not ready. They were not ready to live at this point. Wala pa silang isolation units. Wala pa silang PPEs. Hindi pa dumating yung in-order nila. Wala pa silang. Ang dami pa nilang work. And mind you, Alvin, in my region now, signal number 3 ngayon si Ambo. So you can just imagine. Nagko-COVID, may bagyo pang darating. So it compounds the matter. I was getting text messages from my trainees. I have trainees who are MHOs in Northern Samar. Signal number 3 has been hoisted there. And they were asking me, does it mean that we need to set up another incident command system for Typhoon Ambo? And I said, yes, because that's a different event. So that's a different concern. Sabi nila, then where will we put our evacuation? I have to evacuate 2,000 households. Where do I need to put them in? Magsa-social distancing, magpi-physical distancing ba kami sa evacuation center? What's the protocol in an evacuation center? What do we do? Questions like that. Those are the granularity na sometimes when you're at the policy level, nakikita mo lang buong forest. But the LCE at the ground, nakikita niya yung individual trees. So ideally, our IATF should have the capacity not only to look at the forest, but to look at the trees as well. So yun yung
Yes, Doc GR, would you like to weigh in?
Actually, yun nga yung kausap ko yung nanay ko nung isang araw kasi titinda sila sa palengke tapos nag-ECQ na. Tinatanong ko, may naisip niyo na ba? May protocol na ba kayo? Nag-usap na kayo ba dito sa palengke? Saan dadaan yung mga mamimili para hindi magkumpulan, etc. Napag-usapan na ba yun? Parang walang napag-usapan. Parang yung katulad nga sinasabi ni ma'am, are we ready? Kasi yun yung one, etong GCQ, ECQ, we're just parang nagpoka lang tayo ng time. Ang question nito, paano natin utilize etong time na binibigay natin sa sarili natin? Are we individually preparing ourselves once mag-GCQ na? Pag GCQ na, anong una mong gagawin? Kung ang unang gagawin mo ay makipag-party sa labas, mukhang hindi kulang pa yung knowledge mo or mukhang hindi pa talaga kailangan mo pa muna mag-aral, kailangan mo pang magplano. Ano ba talaga yung gagawin? So parang yun yung parang yung ECQ just gives us time. So what is important is what we do with that time to prepare.
Yes, totoo. Doc RJ, and I know you need to go in a very short while. Any closing message for our attendees?
Ayun, gusto ko lang din po i-emphasize talaga yung participatory mechanisms in terms of how we implement yung mga policies. Kasi yan yung I think hindi pa rin clear clear, nagpa-participate yung civil sa pag-craft ng mga plano. And I think isa yung hamon sa Active Citizenship Foundation. binigyan ko pa kayo ng task eh. No? So, yun. So, parang isa siyang hamon for you na kung paano natin i-institutionalize yung mga gantong mga initiatives na pwede namang makatulong talaga sa government.
With that, maraming salamat sa inyo, Doc RJ, Doc GR, Doc Aileen. Thank you so much for your time. Ang dami nating na-tackle. I don't think I can summarize all of this. Magmula doon sa, our personal roles to our roles to the community, no, even to the roles of our households, hanggang doon sa how do we envision a healthcare system that should work for everyone and a healthcare system that would work for marginalized kahit yung mga nasa malalayong lugar, and hopefully a recovery plan very soon. Salamat din sa lahat ng nakinig at nag-participate sa atin this afternoon. So mga hindi bumili, we still have like 30 plus participants at this point. We're going to have another webinar. I don't know, by next week maybe we'll tackle social safety nets and social protection. So just wait for the announcements from the ACF Secretariat. In the meantime, again, thank you to our panelists. Maraming salamat sa lahat ng nanood. Good afternoon, everyone. Keep safe and be healthy. At sabi nga natin kanina, di ba, magpugas pa natin ng kamay. And take note of that one entire presentation ni Sir GR on your roles as an individual in this global pandemic. Thank you, everyone, and have a great afternoon to all.
Thank you and good afternoon.
Thank you.
Salamat po.